my name's Lily. I'm going to be your nurse today and we'll be removing the IV catheter. First, I would gather my supplies such as clean gauze and tape. I would then ask the patient for 2 patient identifiers such as name, date of birth. I would check the medical orders, make sure that we are actually going to be removing the IV catheter, and then I would perform hand hygiene. Make sure all of that is rubbed in. I would then check the patient's IV fluids, make sure that the fluids are stopped, discontinued, not running. I would then make sure that my IV catheter's line is clamped, which it is, and then we can start removing. I would place 2 fingers onto the cannula. I would start by removing the tape on both sides, and as I'm removing this tape, I would check and make sure that there is no redness or skin breakdown. And there is no redness or skin breakdown happening. I would then take one of my clean gauze. I would have it just above the cannula. That way, as I am removing the cannula, I can hold pressure for about 2 to 3 minutes. And this will kind of depend on the medications the patient's on, such as blood thinners that can cause the patient to excessively bleed. And as I'm holding the pressure for 2 to 3 minutes, I would check the cannula, make sure there's no abnormalities, make sure that everything is intact, which it is, and then I would discard the cannula into the proper biohazard bag. And then I would grab a new gauze. I would remove this one, make sure that it is bleeding appropriately, if it is even still bleeding at this point. And then I would take my tape. I would ask the patient to kind of hold that steady for me as I am taping. I would tape it down, and then I would report all of my documentation onto the records, make sure that I explained the whole procedure that I had done, let the patient know, and then I would come back and evaluate to make sure that we have stopped bleeding completely.